health, church health policy. And a few months ago, we had a presentation on the new church health policy. And see, eventually, our role as individuals. I'm from, right? Any, any who health is together. We are again, we need to improve so that we are not going as a but anything we bring towards health, targeted for the benefit of everyone. Now, usually, the part of presentation now, almost the question is not bad. The part where the said, if you are individual consultation, and so you know, we got that check the observe question now. But besides it, it's about that. We know now we are here. We know we do here. It's a struggle for the health. And I know say you all have issues. Okay? And if you have anything of that program, after this program, we are ready and available together with the time. If you have any individual consultation plan, you can see us and then we'll give you the appropriate advice. Now, in all this, like I said, presentation where it won't be about medical consultation. And now quick solutions and now where I will be for your health. Say, and that will solve the solution. Okay? Now, about any financial advice for health that will give you any relief or anything of that sort. But the presentation way that you said, picture of how health is in Ghana. He said Ghana couldn't get a system, said and then we are going to know the roles of the individuals. Say, what do I have to do? Me as a church member, me as a family member, me as a Ghanaian, what I'm supposed to do in terms of health. Okay? And the social thing is found. Let's know the picture. We have a picture projected. Okay? I don't know those in the pictures, but Michelle goes now. Michelle goes into the picture now. We have hands coming together to form a strong unit. Michelle, please the title slide. Yeah. We're going to room. Picture ring while we were wearing picture maybe black and white and this picture, but you could tell yourself here dark. The next side of the and now beginning. But with all this, push that picture at the glance. A crowd will come or green. Okay? And this is how I want us to picture this presentation as that community. It depends, we are from different families, different backgrounds. But when it comes to unity and we have one group, then it shows strength. Okay? So I just wanted to have this picture in mind. And then I'll start with the truth. A simple truth. Say, hospitals do not create health. Hospitals do not create health. Hospital. And then we are creates a I don't know if you get it. But hospitals don't create health. What they do is they treat diseases. And you go to the hospital when you are not well, and what they do for you is to treat the disease. But all creates the miles. Okay, and as Christians, we believe health comes from God. And God has also given us responsibilities as individuals. Okay, so we should also have that in mind. Then I said individuals. So individuals have a role. Individuals come to families to also have a role. And then all this is shaped by the church, or the community. The way we think, the way we do our things. Okay? So this is the story we will tell today. Everyone knows about it. I'm not going to talk about anything. But my aim is at the end, I want this picture that we are vulnerable. We could be some stories we heard. We could be in the position someone is in now. Not because the person has done something bad or the person didn't take all of his life. But then we are vulnerable for us to have a change. But if you don't have this picture, then it means we are going in any direction altogether. Now I want to give a scenario. If we all take a good picture as a picture, as a story, then imagine that. Now I have to send my water, then I'm here. usually, then it's a travel picture, no cinema or video of things. Usually, and then the first now, the cinema series, and the whole picture, better than the movie channel. And say, we all have different issues. Now, so I want you to focus on yourself, and then the gear that apply to, okay, ABI in one person, one actually have a picture. And say, it's telling you, say, one actually has, so this is what you are supposed to do. And this is what made the whole picture was beautiful. Okay, that's what is together, let's break. That's what this picture is. Okay, so we move on to the next slide. What is health? Now, definition where it's sad from GSS to university standard. Now, health is the state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So, I'm interested. Una atochima, and I said, that we gain, and I said, mental capacity, and I said, kita udienge di pan problem everyone. It also means you could be mentally, physically, and then socially well, but then you can be well. And just like somewhere now, Dr. Joe said, only malaria, only way, and just only area. Because sometimes it's not possible. I just said, you must feel yourself. Sometimes I don't know Sakra and say, and the help looks at all this. And the definition of health subjective Sakra. Because as a Christian, if you told me this is the complete definition of health, yeah, I would accept it. Because as human beings, we know our life is not going anywhere. We are going somewhere after. So to make it complete, we'll say health is the state of physical, complete physical, mental, social, and spiritual well-being, and not merely the absence of disease. So I wanted to understand it in this context. Okay? And for example, in the past, in performing from LGBT, we are not doing that. Okay, in the past, not a mental illness. Okay, in the medical field, there is mental illness, who cause psychiatry in China. But see, our type of system, almost say, almost right in China. So in that sense, is it to be normal? But it doesn't mean we are going to accept it as Christians. No. Okay, so this is the context I want us to, this is the picture I just want us to have. Okay, to see where we fall short and then move on ahead. Okay, so we go to the next picture. The next slide. It's a picture on here. I can see Bema original or how we should Nifusu. Ghana, okay, but Papa, when you try, everybody try what Ethiopia. Okay, now Ethiopia, in proper full state. Okay, now who said, good health. Now almost now almost someone in my baby, and it's all quite Ethiopia one. We are the best of it. Okay, but Papa is going to say now, maybe we will look at it. I want us to understand the context of health wherever you are. And again, to help your own health say hospital, and ambulance, and improve, and there won't be panic and none of this. Yes, it's part of health. That's a big picture of health. If you are a great prevention, okay, prevention is one part of health that is very, very important. But I mean, sometimes when we say prevention here, very expensive. We don't know prevention, and we are not even educated we don't have the opportunity to be spoken to about prevention. If you have prostate cancer 5 years, 7 years ago, no one knew about prostate cancer. In my moment, to be now, you have breast cancer. You have breast cancer. But as time is going on, then we get to know about prostate health, prostate cancer, and all that. Okay, so we get the opportunity we have to talk to ourselves. And other things are there we don't know about, and we are vulnerable. Okay, in Bible say there will be a cervical cancer. Cervical cancer, apart from breast cancer, then there is second. And so second is not saying anything about cervical cancer. So we can't even prevent ourselves from cervical cancer. Meanwhile, it's preventable. Thank God, they are immunization in the environment. So if you are a girl, you know the age of 18, it's what's happening. And the what's happening, it prevents you from getting cervical cancer. The second cancer in Ghana. So, only now, it comes it, and then there's nothing we can do about it. Okay, you spend so much money, and then the outcomes are not good. So it's very important. Prevention is very, very important. Now we have social determinants of health. Now, so the social determinants of health is the conditions which people are born. Maybe are young folks here, maybe are only here, maybe are only tomorrow. And very powerful. Extremely powerful. So you can't stay there. You can't confidently say there. Okay, Obi wa Iran na sport abere a plastic. And so social determinants of health, they never will be that comes together. And they will be said neighborhood and built environment. Maybe I would say close to man, people come to your man or Janino, are they good enough for you to eat? Some advantages one here, almost advantages they use grammar for the advantages and all that. Would you also feel who you PBR council one day will come and law and advantages? Now, so here the would you and the social determinants of health. What think that I will get behind the time? It is all compounding people. You get it? And then economic stability. Okay, now. Anytime economic stability, it's economic now. It reminds me of one lady. Okay, I don't know catch story, but that's family in the Baba and catch story. And other those they are going 860 man. Now dollar is the cost so this man. She spent up to 1,800 billion man. And the other said, you know, instead of suffering every day, every 4 days, no power, every 3 days, no power, every month, we no power, or managing is and the economy, you have the will to be held. Now, so the economy is not supporting your finances by this dedication. Okay, and that's the economic part. It's the impact the profits. Okay, it's the share power on inside the money. Okay, because people want to get profit. Now you are making that a story. Okay, but in Juma all year, you also have a responsibility in this social determinant of health. And then you are doing or food. Whatever you do, you make sure is something that is pleasant to God. So that it doesn't cause illness to someone else. Okay, so it's very, very important. Also, social and community context. Recently, let me talk about social. So sometimes social, we add religious implications. And you can't have religious implications when it comes to social. So this is content the new update with Jehovah's Witness. Okay, they believe or they don't believe in that confusion. Now recently they are said now they are sent to do all that confusion. Because one has someone okay, that's what they believe in. And so we can ask them not more than the more than no, he has no than that. Unity man. Okay, continue to meet money. But at that time, we have people meet money, every money back. So that is what they believe in. And that is their social tech. And people who are open and I say, people that are open. It's it has spiritual meaning. That is out. Okay, that is social technical. Now, education access and quality. So, education, people think say the classroom and after this is education. Okay, education means you knowing a particular topic. So, with people will be here, you have to know about construction, who besides the DNA and then you in Cairo. I mean, the person but you have a partner who hasn't been to, let's say, school in a classroom. And so, on the background, oh, let's start today, who yesterday, man, para, you know, it's helping the doctor to tell you what to do next. So, one can tell you all this stuff. Someone para, that's the first point, before other results. And so, what can you say, para, in the man and one. You see the difference? So, this education is important not for narrative, but you have to know what you are going to see. And to perform you and have the service to be able to the same local, the same complaints. Now, school now they do different. Okay, so education is very, very important. And I'm not sure of this. I'm not sure of this. Healthcare and quality. Okay, healthcare and quality. Also very, very, very important. And sometimes the quality of the healthcare is determined by the way what's in our pocket. Okay. We better select the best hospital in the country and edge. Yes. So all these things come together to determine your health. And then the person will be more. And it is a big area. It's shell. What you say, it's not the complete picture. And only so we have to be very careful about social criminal health. It's the advisor. It's not about all of that health. And so health education, taking 1 hour of time to sit here to listen to very, very important. And the next, your be a friend life expectancy. Social expectancy. Now, you will hear now. So life expectancy, the definition is the average number of years you are expected to live after you. It's your war. And the number of years that you are expected to better based on calculations. Now, this time we are saying here, I expect now I was saying what is the average and what. Now, social with this it's not so clear. Leave the longest, countries where people live the longest. Social map, don't tell post different. Okay? Now, you are interested only up to 90 years. Now, who people now? And now, people today now, who check 50, 55 or more. Now, who oh, Africa. Oh, actually, this is the social determinant of health. And that will force said they will be able to Africa. It's not okay. And to try to set the average, and stress that the move to Africa, moves are in people who are born beyond the picture we have seen, the picture you have first time. Almost someone and answer, and quarantine, they likely be beyond the average age. So this is the picture I want you to see yourself. Say, almost say, if you are born in Ghana, you live this number of years, and say, I won't do anything about it. Let's go with 10 years, 50, 25, it's not 10 minutes. So it's very, very important. Now, when you ask about who knows the country with the least life expectancy? Country life expectancy here, 1 year. So we have experience. the least, the smallest. Okay, the smallest, let me have one Nigeria, 55 years. Okay, 55 years. Now, if you at the highest, and now 87 years. One difference, no, I'm super. Okay, so just where you are born, and then share the number of years. Now, I want to repeat, say, and just that that's when you are going to die. Okay, it is what you do as an individual that also matters. Now, we share little bit of it, or be for Una and our for Nigeria. Now, we will difference. Not difference. Okay, so that is social development. Now, that is the world. And if I want to say, sir, now let's narrow it to our picture. That's a picture. So let's come to Ghana. Okay? Ghana expectancy has increased. Okay? Because of technology, advanced in healthcare. First of all, hospital now, lab. How much more you are about to manage your battery design? Yeah, I want to be trained inside the where and they have been advancement in technology now. So balance, but then we are you need more than we used to be. And social to have more that's increased. Okay. Now in Bangladesh, if they are over the AFS, they have the highest average life expectancy in Ghana. Almost the other 8.6. And then Nigeria the other 63.7. And then total is 66 here. Okay. And here we are. I was telling you talking man, you know someone say, yeah, come with what is making them keep longer or go older? It's environmental. You tell the minutes, right? Yes. And we are now going down to that picture. If they are here, you must see yourself yet in the picture. The picture you're lost. To be an emotion, you see yourself very soon. Now, the top 10 causes of death. Joshua, stroke is the best. Okay, tuberculosis, diabetes, lower respiratory infection, pneumonia, ischemic heart disease, the heart attack is happening. That's why it is. Malaria, malaria, I put in mind. Social determinants of health, interested malaria, I put in mind. Okay, we have some towns around. Intra-kind, they have certain communities around. Now, before we don't hospital, and usually we are that machine buying and another most said, we give you the end days in Bow. But the panel, there are one check. I feel the overarching number in hospital. Because hospital be at the around. The best side of why that's when it doesn't start. Now, usually the problem, malaria, majority of the malaria. Meanwhile, something malaria you malaria this our environment. That's why I'm saying that. And then HIV/AIDS, road injury, preterm birth complications, COVID-19. We are sure that they are very 2051. They are there. Probably there. Won't be there anymore. COVID starting and they can come here. And then the year everybody is here. It's very important. The first is probably about. Second, you get it. So if you are not watching, you can come to you soon. Okay, it's just a matter of time. And then we have kidney disease. Now, obesity is better than hypertension. Now, diabetes for you, and then I don't know where they live in. Now, I tell you diabetes. They're there only a stroke. They're there only a severe heart disease. They're there only a kidney disease. And who will have and the BP was super, all the Nancy, and the time I got the but I'm not problem. Imagine that the night for ya, I think now between the night aspect, okay, it's very important. Now, when it comes to aspect, I have a story to talk about. Usually, preacher or something we say about death that we did not determine as a Christian. You don't determine the way you die, right? Yes. Very, very, very important. The title of more for the Church of Christ, usually we hear evangelism in December. Usually we are called class, so we need money for evangelism. Okay? Now, students, they initially rely on sister churches around the road, to churches around on the okay. Now, particularly, we have initially, and what catch is only movie or Church of Christ, whereby, and see a friend, oh, no problem, whatever. Then, over you were the chairman of the program. Maybe 190 fellowship. Okay, Mumbai has been there once before. It's also known really fast for evangelism. So in 4 days, we had a program and everything. So one day I was on the wall now. We friend said, "That Papa now we are for that wall." Okay, and then we said, "No, the village or the red." Then we said, "We see it's all coming." The car or direct to see now into she and this is someone who is of value to us, who is of value to church, okay, because of carelessness of someone, okay, as God is what. So these are low pitches. Only about 30 seconds. Think about people you lost in life in recent times. And tell me they are not in this list. Okay? And just said, they are not. Me, it's in a general, I'm part of the community. What now? You're also part of the community. So, yeah, I can't wait to cry and say, oh, yeah. Who made that by chance? Okay? So, the picture narrows you. We are all at risk. But if you don't check, you wouldn't know. So one check here. So it's very, very important. Now, if you check what happens, you go to the hospital, where do you go? Get out there. So we have something called the structure of the health system in Ghana. We are just saying, to pray, to be a health center, be a chief. Somebody chief compound. What about less endowed areas background? Chief compound, only to my okay, community health is no more. So that's the level of care in the field compound. It's your community health desk. Although you are your own doctor, or you and so who say sometimes go to okay, I put for community campus and because almost every way a danger and those people's educational level. And someone identified this alarm, no more for hospital can see. Now, most of us here, we are sure that we don't get cheap company because we don't need it in our environment here. And so it's very, very important. Okay. Now, the second level here, primary care, health centers, polyclinic and private clinics. Polyclinic and private clinics. Health centers usually there's the caliber of health workers physician assistant, almost in health delivery. We have one physician assistant here. They help a lot. And so we are the next level of care, like health center. They usually go out to doctor or nurse who are experienced physician assistant and as the even community health, experienced community health officer. They will also call the clinics and have a private clinic. And in our environment, see they all left mouth clinic, and I walk private clinics in around. Okay, so yeah, there are different facilities. Now, this I say, it's not everywhere we go for healthcare. Okay, and I get there now, and now there are people now. You have to know this structure, but it's very important. It's been 19 work on the self measure. Compare yourself with you see, tertiary care, okay, I want to go back to ground. So if you don't know this, first, yeah, okay. I'm saying it because we want hypertension or hypertension. I call area polyclinics are especially in the room. Almost level, we will grant one family. There are area of I was saying sing, and I said, attention there. I mean, keys to be all right now. You need a higher level of care. And it's all harder, you don't see, especially for your chronic disease now. I think you should rethink it. Okay? You have to see, especially for your chronic disease. Area is going to know once in 3 months, and then once in 6 months. Now, polyclinic will still not sure, trauma. And so, in time, now, very review medications and all that. So, it's very, very important. Now, this structure is also very important now because we have elected prevention. Okay, you see, prevention is anymore. We want to survive. And the other the doors, kidney problems have doors, strokes have doors. So, healthcare system will collapse. We are just putting videos that are around that amount of that and then what can we do? Because we neglected prevention and there's pressure on our system. So we can say that the system is failing. So systemic failure, we have to do those. No. Just like the biblical principle, if grace abounds, that means we continue to sin. No. Okay, so we have to be very critical about this. Now I go to the specialist care. My family wants them better. And then more people now, at the point in time, you have to see a cardiologist. Because cardiologists don't know that one once in a while, every 6 months or every year, or very sure one beds. Yeah, specialized doctors. If you have bleeding inside of one, your normal doctor can see, but maybe a gynecologist very sure to see them with a level. And you have to do that early. Say earlier, so that it will be at a level where even when we spend money, we are not going to have any benefits. It's a very, very important. Now, so how can I sit up on any other reports and I get reports and it's kind very, very important. And it's kind of, said, even in building ground, because of scanning, so I was not from architect, this other one, they are also very good. Okay, I won't lie to you. They are also very good. And so, at two level, we are the advice of these specialist people. Okay, even in the early church, we have prophets. Okay, we have teachers and all that. And it's for us to build ourselves. We can't our oil. And that's what we should is build us or build our capacity to get where we want to get to us. Remember, we are still holding our hands. You see, I'm security, we need to but then we have to hold tight. And that's what the church, the family, and the health policy will address. You see, we go to the next slide. The next slide, we have this is the map. The map around Saturday line. Where you are left clinic. It's still there when we see. You are not waiting. Okay? And Joshua, there is 8 8. Hey, say one. You will see. You will maybe see. Okay, good. And you can zoom out. And Joshua, 8 8 there is left clinic around. Okay? And they're there. We have like okay, say jungle. We ensure that the community won't do that. Okay, we have Lebanon Hospital, and they we have Grace Memorial Hospital, we ensure that they see that. We have family development. We have some community hospital. Bill, and the hospital will be around. Okay, but due to certain circumstances, there. Sometimes the hospital now, doctor will show about 90 and ask for environment. So you tend to like that hospital. By then, I like that hospital. It ends as getting the services you need. Okay. But because you don't have the privilege to know all what happens in this hospital, okay, you really know where to go when you have something. So someone can call me. Sometimes I get called. Within the operator. Doctor, this. So, wait, you say, what was the now? Like I said, yes, plan, Sura, and say, who you call her, and Harry was Sura. Who you call her, or maybe piano, it's better than me. I'm not giving you money, I'm just giving you advice. So, I mean, I'm available. The numbers are available, you can call. I don't need to know who you are, I just have to give an advice. Okay, something that will help you. Okay, so when now they are very important. Let one clinic your polyclinic, and it's I think that immediately partner. You have to advise them. If they don't send you somewhere else, you have to advise yourself. Say, see a specialist. Okay, so today looking at a picture, we see a picture, specialist in the okay, okay, you don't know the points at which you are going. But one man or one tenant they said, if what happens to almost shower, it says a winning. And this is this is no seven. Okay, so I'm at risk. Okay, I'm at risk. So we have to be very mindful of this. Your manner mission also very good in terms of certain things. Okay, but these are private entities. I can't say in the public sector when you or like this particular agency. And so if you call and need help, okay, we could help you together with Dr. Regina to help you overcome some of these challenges, tell you what to do and what not to do. So that is very, very important. Now it comes to the finances. Okay, to start healthcare. It's either from cash and insurance. Cash from your pocket, one has a and then from yourself. Because sometimes you can't afford need support from the family and all that. Now, our hand is can be broken. Okay? Cash from pocket so broke, you are not getting the health care. Insurance, Obi want insurance or health insurance. Health insurance and cover the family. And it's a part of one specialist get this now. But health insurance is very good. Now, so what? I won't say insurance. We won't think I insurance because in Paris, I want to grab India. It's only insurance that will be okay. Now, say, if you say, you understand the idea, insurance level come. You just 2.5, right? 2.9%. So, yeah, national insurance. Now, I think daily premium is between 30 to 50. Now, I remember I said, the change why my name is give area. And the someone who said, we are really in following that. We are really in Ghana. The last 2.5 years. Last 2 years. Okay. So that is the help, the change which you have been pushing. Okay. So you have to put it in mind. We are also share every year this beginning. Okay. Make sure for a minute to happen. It will be too late. Otherwise, the burden will come on us. Now, your private insurance also. Okay, they pay premiums, some amount. Premium, the WH one, so every month, on his level, you can say every month, let's see, it's something. But the minute back, you be Okay? So we have to be looking at things like that. Okay? Now, so we care about why you say this side or and the other here. Or the cook. No, you know. Yeah. So, this is giving us a complete picture so far from stay in a society or the social determinant that shape our finances we have around. And I think when we had the discussion on the technology, people raise tangible reason, very good reason said, and can the why one. I can say, it's very true. The why one can get power. Look at the social determinant of development. It's yeah. You get it. It's not money that solves anything. Now, when it comes to help, people are Ghana see Ghana. They're ready to go up. Ghana see it's ministry. It's ministry. So we have to look at ministry. Very, very important. Okay. At this point, per se, break out into three groups and 4 groups. Okay. Now starting Bible posting. People have good ideas that will count, okay, to help the church, to help the society, to help the individuals. Now, I'm broken down into 3 structures or three groups where we are now and what we can do. ABR, I can't tell you where we are. You know what is happening to you. I know what is happening to you. I can talk from my perspective as a doctor. Okay, but sometimes if you are not in the fire, okay, you have a different perspective. Okay, so we want to know the barriers. And see, one group will talk about what have we learned so far. Then now we're doing for talk most global. What concerns you most? Again, what's in I would say and then what do you see as the biggest gap? So far, no, they're discussing. Then I said, I said, we have to come together and solve. So that's how a very, very short minute. Now, second group now, we handle what do you think are the root problems. First, health system and system and prevention periods and personal responsibility, church structure. Then the last one talk about what growth periods should we consider, preventive strategies, policy improvements, ability support, education, governance, and accountability. It doesn't have to be a group. It can be one person who can contribute. Okay, for us to move something like substance so that we can come together and think about it to find solutions for ourselves. So if you are in the microphone, kindly bring it around. You don't need to say anything big. You can just answer one of the questions then we move forward. So, obedience and what are we learning to buy? Given obedience to buy, given the year of one, anyone can just that. Rules, okay. So we can go with this tool.
It's good community. Set up a very many. I'm going to say, I can't want it. Because nobody, if you have a friend, I'm going to say, your fish, everybody is not accepting it. It's not responsibility. It's a good community. I don't know what it is. It's a what it is. Today, I'm going to tell you about health, economic side. Yes, economic stability. Policies and how the economy is being run. It government policies and actions. So that the one number those down there not feel the impact. Let them be and move without saying, because of the policies now. And I remember saying, my concepts, most value about being a church. Say the policy are not us about what are the policy. Them say, ever since you will be whatever we have to do. Necessary. And as so far, I don't know the kind of reports about one of this. And the kind of and the feedbacks, and so far, 10 years, and I look at the that's not this issue. Now, many things now, then when it comes out, when we discuss about it, we see the people. But that's not just for the season. That's what I said. And I said, yeah.
And so when the rhetoric, if we are answers here, because we also talk about it. We are the community and then we need to find out to relate to them. Now, what the community did, almost like this out, almost more this after making almost this year, because so from Supana, and then just who's car, and then just only attacks, and almost like this out, and then almost something alright to start our own build us. And so we can get someone to talk about what do you think are the root problems. Any person to contribute. Just simple. System issues and financial ground, relationship failure, personal responsibility and asset structure.
So process,
You got the same question. And then what gross solution should we consider? And so talk that. Then share solution in blood cleaning. Separation strategies and policy improvement and the main support. Education and governance. What do you think?
okay. That on social factors. The presentation of the book but challenge about what yeah, and said that very common to the city of doctors so we are aware, and especially in Accra here. Because of my background in construction, frequently 6 buildings, I said, but we said, in settlements, no, Accra. Of the problems we are having this time we are having from some of those issues. And then people does not have that proper ventilation and all those things.
We are taking our tips.
But you have to give us education around building system. But to friends talk about what Brothers Commission education, awareness, and preventive strategies through just the same area. Because the school we are waiting, I guess strategy to be a very problem with their home. Indeed, when we have that education, quite often bringing that. ɛbɛboa yɛn ama yɛtumi de nneɛma asisi akwan mu a yɛn yɛn ho ban ma yare no ɛbɛba ba yɛn so.
That's how to talk on the second point, the root problems. But personal responsibility is very key. It's just anything, but you have yourself. If you fail yourself, don't be surprised. But now the health system is one thing. Just like Dr. Miglo was saying, oh, yeah, really. But probably you know those things. But it and as you can say, BP, drug will be better by problem. And like I said, the other Sunday, you do the guys not about church. A true, I accept from if you have a chronic disease. I know as lectureship, because of your better, it's a time the health system, you let's pay close attention to the personal responsibility and then financing gaps.
So I think the system was your communities. We are kind of what they do. What's the city area? We do some but yeah, say, after you feel would be not account, sorry, I not sharing anything. Then those to say them now. And why maybe I thought the importance to cry, yeah, paying and your system was very true. And so, to be honest, first up for hospital, 6 years, probably not 5 years. I can you also. And the challenge, you know, is sound. Obia, what the picture? Oh, good picture. Obia, everyone is talking about this very picture. We have the solution. We have the solution. And the solution, we don't tackle it as one. Yeah, I'm sorry, you know, now, I'm sorry, you know, now, I'm sorry. Remember, in some, there is going to be a sound. Have that picture in mind. So, the strategy is there is no one strategy can be anymore. It doesn't have to be with only money, it doesn't have to be with the system failure, it doesn't have to be with unity strength. Okay? So, for instance, the example said, almost Saturday, if you know it's not good, you give that advice to the particular person. If they are wow, our kidney problem. And yes, you get it. It's not showing yet. That's the hormone we do not affect nothing. You get it. So there's no one solution to this. Now, Sika can solve no problems in that. One is very important because it doesn't solve all problems. Okay. And then, like I said, we are affected by the environment. Then life expectancy is not determined by individuals and groups. Promoting healthy lifestyle or promoting healthy lifestyle and prevention is key. And social becomes more sessions. So you will have a lot of questions coming. Now, what we are going to do with this question is that we are going to divide them into multiple sessions. Like brother talked about, on CBBI about what the church is doing. This is part of it. Okay, this is part of the whole architecture of the development. Now, we are going to see anything big like this. So, again, not really big. And it has been a long time done not big. Now, how do you know? Like I said, opportunity people don't see BP in the dynamic. Opportunity should be or dynamic. It can be the two side of apostle. Do you get it? And then, how can we say it trains the church a lot? So we modify how we are going to do this. You see, I don't have a whole time talking about 1 hour. Maybe after Sunday, 15 minutes, in fact, one topic, eventually we bit na your wahasi check. If you are January cervical cancer awareness, well, we are now I was in shape. So you can go to this facility. When you want to insurance you cover for year. So those are the tiny things we have to do with. And you have to really do it because Jeremy, yeah, the diseases are a lot. There are lots. Okay, so that's how we tackle it. So the question is not handling, but the solutions we can't really that because it is something we have to take care and then answer it bit by bit. Okay. Now, responsibility as an individual. We didn't answer it. Said, I was there university seeking medical knowledge. The medical knowledge we need to say the okay, we should see. You have to be very careful. You see, so you have to be very careful with the kind of information you get. Okay, we better say, doctor, make us say, it's yeah, okay. If I hear what you told me, the doctor said, it's because I'm not sure if anybody. So we have to be careful about the information you get. You see, there's nobody about social media, you can read about health, but you have to be very careful with information you get from social media. Then seeking a health and education program. I think in the past, Maposi subsidized health in states and into the church page. So we were making and Hannah. To be there, the corner by the corner one day, and sure, the moon said, hey, just in 9 and the area. Well, this was just in 95. We have to take advantage of health and education programs. As programs, health programs, we have to make use of them. And then investing in medical devices. To the fact that we will be constantly machine. Hey, dear, in fact, say a child, so I'm going to batch out there, on top of the machine. Because very silent. Because to be honest, for blacks, who did 40 years, and I put them 40 years now, you don't have to do anything to get hypertension and diabetes. And you don't have to do anything bad. Blacks, that's what research shows. Who are in now, you can get hypertension and diabetes. That's why you be why 1 year now diabetes. So you have to get the blood pressure machine. You have to get the sugar checking machine. Now, who talks about you have to know how to use it. You have to know how to interpret the results. And this is the practical solution, and this is what we are looking towards in the coming weeks. Okay, very, very important. Now, making use of awareness day programs and in the area September, October 11, September, States awareness. We talk about posting, but that in day. I'll tell you, we love saying, once for the water. Obey so again, love to buy and I was saying, bios. HBR, and yes, in quality, yeah, bios. And your call that process no there, a crowd. Now I just say, can't see one as I can see. You get it? So these are real life. You can't not pay. Picture now. With the answer, with the man, I said, yeah. Now, yeah, I mean, that particular thing. It's very, very important. Now, we talk about the responsibility of the family. Okay, it's very important. Now, we have children in the family. Only the only parents, you brought them into the world from where you are. You have to be vigilant, take care of them, know that the mothers are very, very intelligent. Some too are not so sharp in picking that. And they have to build the capacity into that to pick all those things up. Okay, and then the family is the first point of care. Health decision maker. People say, who you are going to so I didn't know that there was something called Nansan, right? 3 days. So usually when I was working in Bulgaria, the people who come in here, okay, Nansan, if that is 3 days, no matter how difficult, say 2 3 days, I will back that. Now, financial background, okay, for being staff or now, even out of ABI is almost that time, there was no cost. Right. Okay, so your family will help you. Okay, they are a financial background. And then daily health environment, daily health environment. In Kenya, how they cook. Nigerian videos are much. What? And every family have their way they cook. They say the families like such a. So the difference is boom, but I'm not saying it's not very good. I'm saying the family is the one that telling that. Because it can increase your cholesterol, it can give you certain illnesses. So it's very, very important. Now, looking at this, we'll definitely have a dietitian comes to talk to us. Now, we are here several things in one way from childhood to now. So you can't say anything. Okay. Because eating what we eat in time, so we change right now. And it's like you're right. Asana. One person will say, see, Asana, wait. I'm just sad, who was Kaka, who got how to talk to who no knows. But then it's something you have to start now. If you don't start now, and care of in the future. Now, my mom said, we are car one new car. So also new car, you can go the workshop. Who uses 5 years for workshop car? The good level we are at. Oh, certain cars, the character of the school. The car from half second. The car from second to the Mujahideen. Oh, nípa tó ti lè ṣe ìwọ̀n rèé ẹ̀jẹ̀ lọ́wọ́ ṣẹ̀yẹ̀ wọ́ àkókò sáńkà ìwọ̀n títẹ̀ lè ṣe òun ẹ̀jẹ̀ kí àwọn kan tó ta. You need to get that level before person anything share that. Any man, you can't just say anything that it's for them. In higher countries, you can read rules. You get it. So we have to start now. Okay, we have to start now. And it's never too late wherever you are. Everything can be with them. Then we talk about family outcome, the family support, and reducing complications. It brings about better health outcomes. And then late presentation of big family system brings about advanced disease and then high mortality. Now we move to the what the Church of Christ health support policy. Now we understand, and I said, the church, the family can do everything. Like our brother spoke about the government. So many factors. But are we going to sit down and say the system is broken to them? No. You have to do something about it. That's why leadership together with some members so that those are the good opportunities to help ourselves, to build ourselves and to build the unity we have. Okay, so that we can pick up people who have certain challenges. But we won't do this already, but what I want us to focus on is the rationale. Okay, so the rationale is to help members physical related challenges by offering financial aid and medical advice. It's not all about money. Health advice. We haven't prepared health talks free 10 minutes, 5 minutes. Okay, members who can afford and will come in and will see how to help. Okay. So now this picture, slide 23. Now this picture is very important. Okay, it shows the health system, the training health system. It shows the family, the individual, the social determinants of health, family supports, the church, and all that. Now the church is trying to bridge all this. You get it? Now overreliance, like national and social support. If you say we are all going to depend on this health policy in terms of finances, the bridge will break. So we are going to add up to a paying system. So it's up to us all to come together and pull this together for it to be strong. I don't want this situation, or we don't want the situation where interns to come and say the health policy. Because people have abused it, people have used it for their personal gain. And I've had situations where people thought that they have certain health condition, they want you to sign for them so that they go for money and all that. Our responsibilities to manage to ourselves. So it's very important. That's what I wanted to do, I think. So my closing remark is that whoever can be trusted with very little can be trusted with much. And whoever is dishonest with very little will also be dishonest with much. So I didn't come today to talk about your individual evidence. I didn't really talk about you as a picture. But I think giving a snapshot of what could happen to you in the future, how vulnerable you are in the future. So this little you have to apply yourself accordingly. So we are expecting that will be changed in our lives in terms of how we eat, how we exercise, and all that. And in subsequent days, our Dr. Regina will come through, talk about the women's health and children's health. We talk about adult health in also. We address all the health issues. Okay. Then we expect that bit by bit, everyone look at himself in the picture, tweak himself, make himself and the whole picture to be very nice. So at the end, slide 27. Yeah, so at the end, we have the church, we have the family and the health system. Okay, if you look at the pictures here, that's series of family coming together as a church. The picture, people have smiles in there, but what it doesn't show you is the underlying sickness we have in us, is the vulnerability we have. The picture doesn't show. You know what it shows. So take your responsibility, address it, and as a whole, as a family, as a church, have a beautiful complete picture. Thank you, and I'll take questions as well.
One or two questions. Yes,
how many times a year?
Okay. So that bueno, they check out on the based on their health because food stream of around 10 years ago where posted. The train a measure outdoor and elderly health. Systematic. It's not making the and then one-on-one you're going to see most and to address all the health issues. So that's it.
Okay, it's a question people be moving. The better doctors say, when I look on them, so that it's a doctor who will share the answer. Remember, I see my chapter. Yàrá òtútù wá sí ẹ̀dẹ́ ẹ̀dá ìdí kan ẹ̀wọ̀ báyìí wà náà. Yàtọ̀pọ̀ adarọ̀mẹ̀ntì ẹ̀dẹ́gbẹ̀dẹ̀ ilẹ̀ abẹ́ ẹ̀yẹ. Yàrá àdúrà pàtàkì yẹ̀bẹ̀ tó aṣọ na yẹ̀wọ̀ dọ́kítà Regina òsì ẹ̀sìn. Ọ̀nà ẹ̀nà ọ̀dẹ́ ẹ̀ma bẹ́ẹ̀ kẹsà. N'asẹ̀ ẹ̀yẹ safeguarding mothers and children, building health from the beginning. Say therefore, number 4, ending the back. Finally, first, very important a free young woman accompanying say in a book for years after. And then there's something, let us say 20 minutes past. Let's go. We are about my branch. point about 8:35. That's 5 minutes late. President in the street now. Happy. If you are paying to know about my not in the beginning of the video.
Now we are on. That was you are young. That one. Because I'm making one of the our man on the date. And so my sister that was what we are the mind and what's up with the so about so. Yes, so I are so about it, it's here. Yes, the problem we are on. Now, we are actually found the womb, we are as a dear womb, we are media also the work was a video in the prayer we have so the life so I don't mean yes the baby tina you will be and that time is you say that why you also also it's was actually so missions also is a man it's a day man it's a so answer Say that they are bringing now, which means I said, we see a man to see the bear, the Freud to suffer the human. Why just our door or pen and then pen which me about when you see that she was. The possible to be a farm, which not a good enough solution once. And I'm also a young was, but now near the chest and also. But also now come. Say that they shall see. But one day now. Now we be experience here also your man there. They really feel them and say they must show them. And check the freedom if you also self check. Say okay, I will not tell us to give to us feel. But I am the fears feel. And now we do so say and the be. One for no other way, well, oh, now I also just a shame. That was what it name, so it's here. It was away on our soul and our dominated for his Christian. Amen.
Amen. So, in the issue, is it a man 90, a man 31, and a man 20.
Oh, bini ho to misaye yari, bini ho, Yesu niye halinara, obediye mrenina, adafu bini mose Yesu, bini ho, adafu bini ho kroni mutie. Bini ho, na alafu bini ho amojo. Bini ho, Yesu niye halinara, obediye mrenina, alafu bini mose Yesu. Bini ho, Bini ho, sumini ho, nido chichi yenre. Bini ho, Yesu niye halinara, obediye mrenina, adafu bini mose Yesu. Bini ho, wei amote fobia mapen. Bini ho, ana wajiro ni fobipen. Bini ho, Yesu niye halinara, obediye mrenina, adafu bini Benigno, obeyamuti formare suo. Benigno, benigno, Jesu nime haudinara, obedie impregna, adafubini mose Jesu nu. Benigno, benigno, adafubini mose Jesu nu. Benigno, benigno, benigno to Messiah yari. Benigno, benigno, Jesu nime haudinara, obedie impregna, adafubini mose Jesu nu. Benigno, benigno, adafubini mokroni untie. Benigno, benigno, na adafubini mohamojo. Benigno, benigno, Jesu nime haudinara, obedie impregna, adafubini mose Jesu nu. Benigno, benigno, birebiarani omenye. Benigno, benigno, sumini nido chitrienre. Benigno, benigno, Jesu nime haudinara, obedie impregna, adafubini mose Jesu nu. Benigno, benigno, veni amote phobia mape. Benigno, benigno, anawajiro onifobipe. Benigno, benigno, Jesu nime haudinara, obedie impregna, adafubini mose Jesu nu. Benigno, benigno, acedebisi la cimpaiana. Benigno, benigno, obeyamuti formare